Hi, it's Dr. Noel Williams, Oklahoma City, Oklahoma, Optimal Health Associates, COVID update, June 17, 2020. Sorry I haven't done one in a week. I've been camping in Colorado and didn't have any electronica or internet, and it was great, to be honest. But now I'm back, and I thought I'd do an update as things have changed over the last week, I think pretty significantly, at least in the state of Oklahoma, and there's little signs of change in the country. The biggest news really with COVID is the earlier predicted second peak for the end of June is actually occurring. It was predicted there's going to be another one. There's another predicted peak towards the end of August. So we're expecting a peak for the next week and a half, and then hopefully things will turn back down. When we look at people getting COVID, as I've talked about more recently, it's younger people, 20s and 30s, and probably maybe a few years younger than that even. But when we look at the hospital numbers in Oklahoma City, we're up about 30 patients in-house. I'm checking today, 30 to 40, which relatively isn't that many compared to the fact that we've had several thousand cases over the last week, or a couple thousand cases. So relatively, we're not having the big pulse in hospitalization because the patients who are getting diagnosed with COVID are younger and healthier. And again, those people may get some symptoms, might get a little flu, might get a little cold, but for the most part, their immune systems are going to protect them from the virus. We've had someone in our office get infected. She's doing well. She was on Plaquenil immediately upon hearing about her exposure, and has done well, and really, other than losing her sense of taste and smell, has been fairly asymptomatic. Again, the thing about having cases to remember is there's going to be more and more of them, and they may occur at maybe someone at my office, it may be someone at Target, it may a worker at Target, it may be people who've gone to a restaurant, and that's what we just have to get used to. And that's not anyone's fault that happened, but it is something that we need to be aware of, and that these places that have it are going to clean up and they'll be fine for business. So just please keep that in mind. As we look at what's coming up over the next few weeks, just more cases. I think we need to all be taking our vitamins. We all need to be cognizant of those around us. Are probably on a daily basis or every few days now in Oklahoma, you're going to be exposed to someone with COVID. When we're having 250 cases plus in a day and have for a week, figure each of those people is going to expose 50 to 100, maybe more people, just through casual contact and being around before they even know. So at this point, I think we just all have to be ready to be exposed, and if your immune system's knocked out, you're going to be fine. If you're not in good shape in terms of your immune system, you're not on vitamins, you're not eating healthy, you're not exercising, you're going to be at a lot greater risk for getting sick if you do get COVID, and if you're older, you're at risk for getting potentially critically ill. So think of COVID now as being ubiquitous in the environment, or all over the environment in Oklahoma City. It's going radically up in Texas, Arkansas, Georgia, the southern states right now a little bit, also in California. So there's going to be more and more people walking around with COVID who are relatively asymptomatic, and they're going to be spreaders. And it's just how it is. So we need to be washing our hands. We need to be using vitamins. And that's going to be my central theme moving forward, is I don't believe shutting down makes a lot of sense anymore. There's too much COVID in the environment to shut down. Unless we're going to lock the entire population in their homes for the next year and a half, that isn't going to work. It's everywhere. So rather than do things like that, I think we need to focus on prevention, and the number one way of preventing someone from getting sick from COVID is immune support. which I've been talking about. Number two, if someone does get exposed, if they're a higher risk person, I think they should be immediately started on prophylactic Plaquenil. Another update on, or anyone who has a positive culture, I would always give them 5 to 7 days of prophylactic Plaquenil or early treatment to prevent progression of disease. Number two, something to keep in mind, there was a study that was a preliminary study, and of course the World Health Organization has said it's definitive now, but it's a sensible outcome to the study. They were giving dexamethasone, which, I mean, I've prescribed innumerable times, and almost every doctor on the planet has prescribed innumerable times. Turns out it turns off the inflammation in the critically ill patients. I've mentioned before that the steroid data had changed. The initial data out of China showing that it perhaps wasn't helpful was incorrect. So not a surprise that this study came out. There'll be more and more things like that. Vaccine-wise, I think we're still in process. I'm never going to be pushing for vaccine use until we have it clearly established it's safe, and that's going to take a while. So we'll see. So that's the main part of the COVID update today. Am I missing something?
Well, since more people are exposed, you're getting the question about zinc and zinc pulsing again. Can you go over that?
So if you get exposed to COVID, you should take the following steps. You should do 50 milligrams of zinc an hour for 4 hours. So 50 milligrams each hour 4 times. And of course you may do it in 6 or 8, it's fine. But we try to do it in 4. You need to do it with food so you don't get an upset stomach. Eating is required in order to not have your stomach get upset when you're taking that much zinc. Now, if you're a smaller person, 30 milligrams every hour for 4 hours, if you're under 100, 115, 20 pounds. But again, just getting anything over 150 or around is going to, around there, if you're a medium-sized or larger person, is going to be fine. And that's really going to knock down the viral intensity. You also want to make sure you're taking a multivitamin, vitamin D, and all the usual things I've talked about. I would also, if you have a physician you have a relationship with, you can call and notify them you've been exposed and request Plaquenil. It will be on a case-by-case basis for your physician to decide, or provider, nurse practitioner or physician's assistant, to whether they will give you Plaquenil in advance. And that's really the main things you have to do. That's what we're doing. It's working for the people we've done it for. And that's what the Yale study again showed, which is why we're doing it even more aggressively than we were before. So anything else?
That was the main one.
Okay, I'm thinking I'm supposed to talk about.
You're supposed to talk about, yeah,
of
you're
course.
supposed to talk about I don't know how to say it.
Of course, yeah, I will. I promise tomorrow. Well, that will be my goal for tomorrow. So that's the COVID update. I hope all of you are well. Remember, I'm always doing my best to try to give you the correct data. Be safe and take care.